Hello, and welcome to the Three Questions podcast, where we dive deep into the world of wealth management and connect you with industry experts. I'm your host, Wayne Baxter, Senior Executive Manager at One Capital Management. Now, if you or someone close to you is concerned about and wish to learn more about the health risks related to aging, stay tuned. Our topic, the three questions to ask about reversible health risks of aging. Thank you for taking time to check us out. And if you enjoy this episode of the Three Questions podcast, please consider liking this video and subscribing to our podcast and YouTube channels. Welcome to another episode of the Three Questions podcast with Wayne Baxter. Today, we're diving into the world of healthcare and for ourselves and for our loved ones. Our topic, the three questions to ask about the reversible health risks of aging. Joining me once again is New York-based Dr. Gerda Maissel. Dr. Maissel is the physician founder of MyMD Advisor, a medical navigation and patient advisory service. Dr. Maissel guides people with complex health problems through the care maze, and she is fluent in doctor speak. Dr. Maissel, great to see you again. Thank you for making time to check in with us today. Appreciate it.
Great to see you, Wayne. Thanks for having me back.
Yeah, I'll tell you right now, one thing that always happens when I talk to Dr. Maissel is I learn something. and I think our audience did too the last time you checked in with us. And so I'm really looking forward to our conversation today. But, before we get to the three questions, I think it wouldn't be a bad idea, because, we are constantly gaining new listeners. Maybe if you could give our audience a bit of a refresher here on MyMD Advisor and the services provided therein.
Sure, Wayne. I provide a unique service in which I advise people or their families. Often it's the families who hire me when there's a really complicated issue going on in the American healthcare system. So the person's loved one might be in the hospital, perhaps they're there for several weeks, and the family's tearing out their hair and they don't know what to do. Or maybe the loved one's in the community with 10 doctors who don't talk to each other, and they're worried about too many drugs or conflicting input, and they need an objective person to explain things and help them make informed decisions.
So in a way, it's like you're sitting on this side of the boardroom table. You're sitting on the client side of the boardroom table, if you will. In other words, you're the advocate on the client side.
I'm an advocate, I'm a translator, I'm a supporter, and a lot of the trick is knowing who to ask, what questions, in what way, at what time. People can spend a lot of time spinning their wheels asking the wrong person questions because they think somebody's in charge of something they're not actually in charge of.
I know I asked you this the last time, and I just because you're aware of this. So this podcast not only reaches folks here in the U.S., but they also reach people in Canada. In a pinch, if someone was, say, in Toronto or Vancouver or Halifax, Nova Scotia, and they felt that they were not getting through, or they weren't connecting or communicating properly with their doctor, would you be able to step in there as well on north of the border?
Well, what I could do is help them know what good care is, or how medical issues are treated. But what I can't do is advise on the roles of the different people they're interacting with and what those hidden economic incentives are. Because in America, there's a whole system of opaque
different regime, understood.
And very different in the Canadian system.
But if someone wanted to reach out for you and pick your brain, you could at least be a bit of a resource.
Oh, I'm always happy to talk to people and point them in the right direction, even if it's not my services they need. Sometimes people just need, a 10 or 15 minute check-in with an objective person to know whether something makes sense.
Perfect. So the last time you were on the podcast with me, we addressed the three questions you should ask before hiring a medical advocate. Now, in the event, if you're listening to this podcast and you didn't hear that episode or see that episode, I would encourage you to check it out And wherever you listen to our podcast, whether it's on Apple or Spotify or on our website, we have more than 100 episodes in our ever-growing Three Questions podcast archive. Lots of diverse conversations in there, and I encourage you to check them out. Okay, now, Dr. Maissel, we're going to turn our attentions again to ourselves and to our aging loved ones as we address the 3 questions to ask about the reversible health risks of aging. Let's get right to it. Question number 1. If I could do one thing to reduce my dementia risk, what would it be? Dr. Maissel, over to you.
So I'm going to answer by telling you about something that you may not know about. Most people know.
Again with learning. Go ahead.
Well, we'll see. Maybe you know. Most people know they should exercise. Most people know they should, control their LDL and their cholesterol. So I'm not mentioning those, which are things that help reduce dementia risk. What I'm going to mention is get your hearing fixed. Hearing loss is associated with dementia. It is actually one of the top things that is associated with dementia, and that is a reversible, treatable way to reduce your dementia risk. If you ever seen those folks who are older and now they finally got a hearing aid and they're sitting there going, "Oh, what'd you say? What'd you say?" Because even when they're amplified, they've lost the neurologic ability to decipher words. And that untreated hearing loss is associated with the dementia risk.
Interesting. That is interesting. Noted. Interesting. Wow. Okay. So are there any other specific, I mentioned hearing, but are there any other specific warning signs or early symptoms of dementia risk that people should watch for? You mentioned hearing, but is there another one, anything else that you would say that they could act on proactively?
Well, uncorrected hearing loss is a risk of dementia, but there are signs of dementia that are different. Hearing loss is not a sign of a dementia.
Fair.
Hearing loss
except for the person themselves, but yeah, fair.
Is a risk factor for getting dementia. If you wanted to know about signs of dementia, and it can be really confusing and people often get scared, it's common when we get older. I just did it the other day. I was trying to remember the name of some fancy catheter and I couldn't remember the name of the thing, even though I just read it a few days before.
Sure.
Forgetting the name of something or even a person's name, that's not dementia. But if somebody in the same conversation is repeatedly saying the same stories over and over in the same conversation, they are forgetting in a very short-term time frame, that they've already told that story. So, and that's different than not being able to recall a name. Another common sign that you will see is difficulty managing multi-step or complex tasks that used to be really easy to do. And that often shows up, it happened in my own family where mom was just suddenly not getting her bills paid. She was otherwise pretty good. Occasionally repeating, but all of a sudden late due notices. And my mother had paid her bills her entire life. She was the bill payer for my family.
She was the administrator.
Yeah, she was. And she couldn't do it anymore. And so my husband took over her bill pay because she just couldn't do it. And it was one of her earliest signs, even when in conversation and in function, there really weren't other signs to see. And another one that goes along with that is disorientation. And disorientation might be to day or to day or night. It might be, is it Monday or is it the weekend? And when this happens over and over, people are just confused about where they are, or they get lost. Now, I get lost. I have a terrible sense of direction. I'm talking about, we'll pick on my mother for a minute again. Mm-hmm. My mom drove to my house hundreds of times, but then she started showing up late, and I figured out that she was getting lost on her way over. And so we put a tracking device on her. her phone. So in case I had to go get her and she couldn't tell me where she was.
Interesting. So a follow up on that one, and this is a personal. This is where I'm going to find out if I'm going to get myself debunked here, but that's fine. I'm really lucky in that I love what I do. I love my career. I get to pick who I work with. I think I have wonderful relationships with almost all of my clients. I look, I meet with them regularly. Some people maybe say too regularly, but I enjoy the conversation. I enjoy the company, and I enjoy the interaction that we have. I love the planning work we do. I love meeting new people, yourself included. And I'm very active, as you know, in here in the U.S. and in Canada, connecting with professionals through my provisors relationship, and I'm also now a member of the Canada-Florida Chamber of Commerce, active partner there. And in my mind, I think to myself, if I wanted to stave off, the potential for Alzheimer's dementia, I look at keeping myself active and working and all the work that I do and all the planning and my regular activities is also a way of staving off any type of that type of Alzheimer dementia symptoms. Am I misleading myself to think that all of this is going to benefit me, or am I heading in the right direction here, do you think?
You're definitely heading in the right direction. And the studies are best around longevity, not necessarily on dementia specifically, but people who do meaningful work, whatever that is, but meaningful work, and people that have social connectivity live longer, a lot longer.
All right, well, that's good to hear.
So
But also the fact that my work, to some degree, maybe some people will argue this, but to some degree, my mental acuity is constantly being challenged. I have a lot going on, traveling and working with clients on fairly complex situations and connecting them with other people. That in itself is a beneficial I think of it more from a mental acuity perspective, not just a longevity perspective. Is there any correlation there?
It's not completely clear. So, people want to do Sudoku puzzles because that's going to stay,
Right. Exactly. Precisely. My wife has the same thing. She does all these puzzles on her iPad all the time. And
I think it's great to keep your mind active. I think it's an important thing to do. But the studies that I'm familiar with, and I'm not the world's top leading expert, are more about longevity than they are specifically on dementia. But if you get dementia, it reduces your longevity. So
of course,
I suspect it's indirectly helpful, because if you got dementia, you wouldn't be able to do the things you're doing.
100%.
But whether doing those things prevents dementia, I'm not completely clear.
Well, I'm going to carry on regardless because I love what I'm doing so much anyway.
Exactly. You should.
Exactly. To me, I believe that having a sense of purpose really is part of having a fulfilling life. And I feel that way very strongly. Okay, great. Great first answer to our question here. We have Dr. Gerda Maissel with us, and she's with my MD advisor based out of New York. Question number 2, what could I do now to minimize my health issues in my 80s and 90s? And that's the thing, that people are living longer. I would note that I don't know about you, but now when I read about some notable person, athlete, entertainer, politician, whatever, when you read about anybody dying before they turn 80 now, it kind of raises my eyebrow.
Yep.
I think more so than back, maybe in the 1970s, 80s, or even 1990s. I remember when Pavarotti passed away. I can still remember the moment. I was sitting in my office in Toronto. It was in the evening after a fairly busy day of appointments, and I just turned on my Globe and Mail browser, and the headline was Pavarotti dead, I think at 71. And it was like, wow, was he ever young?
Yeah.
He had pancreatic cancer, I think, as I recall. So, what are things we can do now that can help us later on?
Well,
You
we've
mentioned exercising and diet, but is there anything that people are
and that
missing out
those
on?
are, yeah, exercise and diet are very real. They will make a big difference, as will weight control. And there's, a whole discussion about the drugs that are out there now and whether they're going to affect longevity. But there's already some preliminary data that people who have lost weight on these drugs do appear to be living longer. But one of the things that we can do, and you touched on it, and for you, the social connectivity is through your work, but social connectivity makes an enormous difference to our longevity and the quality of our lives. And I have a friend who she called it, and I love the way she framed it in her mind. She called it building her circles. So she had gotten divorced in her 60s, and in her 70s, she moved to a new community. She didn't know anybody there. She picked it for a variety of reasons. Her sister was nearby, but not nearby. She was about a half an hour away. So this was her community. And she set out building a series of mostly women circles. She had a book club circle, a water aerobic circle, a Bible study circle, she had about 5 or 6 different circles. And every time I would visit my
Interesting.
friend, yeah, she was always making chicken salad. I had this memory of her always making chicken salad for somebody who was sick in one of her circles. But now that she's in her 90s, all that effort to build her circles has helped her. So when she needs a carpenter, somebody in her circle knows one. When she needs someone to take her to the doctor, she's got somebody in one of her circles to take her. And one of the things when I was talking to her about this the other day, she told me that she has to refresh her circles deliberately because the woman that used to give her rides, well, she broke her leg. So now she needs a new person for giving her
Or
rides.
passed away, even. Yeah.
Well, and that's what happens as people get older. The people that we are all used to relying on, some of them pass, some of them become ill, some of them move away. And so one of the secrets to successful aging is looking at who's in your social orbit and deliberately building new connections. And it doesn't come easily. There's a few different ways to do it, but you have to be deliberate about it because your world
Interesting.
will shrink naturally when you get older.
Yes, absolutely. Okay, let's say someone starts making these changes in their 50s or 60s. Objectively speaking, Dr. Maissel, how much of an impact can they realistically expect to make? By the time, do you think it's like moving the arrow, or do you think it's a monumental shift, or how would you respond to that? Do you think these makes a dramatic change, dramatic impact?
I think I don't really know the answer to the question, meaning I think it makes an impact, but exactly how much depends a little bit on what life deals you, because life isn't a straight line and there's a
100%.
lot of luck involved in life. And so all you can do is improve your odds by being as healthy as you can. So if something bad happens, if you're fit and you have a car accident, you're going to get back on your feet faster than if you are very heavy, never exercised, smoked, and drank every day. So you're improving your odds if something bad happens, but you could smoke and drink and never exercise and live to 100. It can happen. It's just the odds.
Yeah, I remember when I was a kid growing up, we had one of my mother's uncle on her mother's side was a chain smoker.
Mm-hmm.
He lived into his 80s. I don't even think he died of anything related to. It's like total anomaly. Like everybody was like, "Good
Yep.
Lord, this guy never without a cigarette, smoked all the time," and it was just really interesting. And he had warts. So
Oh gosh.
remember this guy very well as a little kid. Anyway, okay, so I got to ask one more question along this vein.
Sure.
Are there any medical tests or screenings you'd recommend people prioritize now to catch up on potential issues early and improve their odds later? Is there anything that you would suggest?
Well, can I answer that by suggesting both medical and non-medical things
Yes,
people can
of
do?
course. You're here for a reason, Dr. Maissel.
Okay. Well, one of the things that I'll point out that comes up regularly with my clients is what's known as polypharmacy. Polypharmacy is taking too many drugs, many pharmacy drugs. And I find that a lot of good people are trying to follow the doctor's orders. And by the time they hit their 60s and 70s, they're taking 10, 15, 20. I had one guy on 30 pills a
Holy
day.
smokes.
And once you get above 5 pills a day, you've got over an 80% chance of a significant drug interaction or side effect. 5 different medications.
Wow.
So
That's excluding vitamins, right? We're talking
just, yeah,
actually.
mainstream drugs, although
I,
you have a little bit with vitamins in there. I had one guy who was taking 3 forms of vitamin D. He was taking the pills, plus he was taking so many other supplements that also had vitamin D. He was vitamin D toxic when we checked a level.
wow.
But taking too many medications or taking medications that cause side effects is a huge reason that people over 65 land in the emergency room. And what I tell people is that we as doctors, we're trained, you have a problem, we give you a pill. We are not trained at stopping medications. And there's a cultural bias against stopping a medication that another doctor ordered. So pills just pile up. And I think one of the things people can do to improve their chances of staying out of an emergency room and of having a good quality life is to sit down with their primary care doctor and go over their medication list and really decide, do they need to take this drug? I'll give you another example. I had a client who had terrible osteoporosis. This gentleman had taken a drug for his stomach that was known to cause osteoporosis. He'd been on this drug 20 years. And I said, do you still have these symptoms? He's like, no, I don't have them. I take the drug. I said, did you ever try stopping the drug? He's like, well, no. I said, why do you take it? He said, because my doctor orders it. So I talked to his doctor and I said, hey, do you think he still has this? He's like, I don't know. He shows up, I just renew it.
Whoa.
So he was perfectly open to the suggestion, well, how about we try weaning him down and what do you think of trying him off of it and see if his symptoms come back from over 20 years ago? He's like, sure, we could try.
Well, that's an interesting story right there because, I have my own doctor, Dr. Simpson, hello. And contrary to that experience, I have to go see her in order to get any prescriptions I have renewed. In fact, if I go too long without seeing her, I get my wife comes home usually with a message. Dr. Simpson said she's not going to renew your prescriptions unless you go see her. So it's interesting to have the other one where they just basically just blindly renew it. Rather alarming.
He may have gone into the office, but what I'm suggesting is that when you go in for those renewals, you have a conversation
But whether or not they're still required. Again, I
whether they're
understand.
still needed and what you might be able to do to test whether or not they're all still needed.
Understood.
So
Excellent.
that's one of my favorite ones to mention when it comes to having a good quality of life and keeping yourself out of the emergency room. But there are other things that people can do. One of the other big things that happens when we all get older is we get weaker and our back, unless you actively counteract it, it's just a natural process, and our fall risk goes up. So
Falling's huge,
falling
huge.
is huge.
Absolutely.
And so
it's no longer fun when you're 65 years old and you have a fall. I just have a situation here recently with a very close family friend of mine who fell, and this person is very active, exercises, and the recovery for them to get back on not literally on their feet, but back up and running has not been easy. It's no longer fun and games when you're in your late 50s, early 60s, and all of a sudden you take a tumble. It's a traumatic event
That's absolutely right. And it's worse when you get older and you take a tumble and you break something.
Exactly right.
And
You're gonna
so,
hit your head in the middle of the night going to the bathroom and you tumble hit and down you go. And yeah, it's
so there are some things to do that it won't stop you from falling, but they can reduce your fall risk. Common things are, we have a lot of trip hazards in our house.
yeah,
A lot of people keep floor rugs around, and it's easy to catch a toe on one.
yeah.
Or there's clutter, or in these days where things are wired, there's wires crossing the
Hmm.
floor.
Hmm.
And then pets are one of the main reason that people fall. Either Fido pulls the leash and you go flying because Fido saw a squirrel,
You don't see when you fall over them, you trip over them.
or you trip over Fifi who was at your feet and you didn't realize it.
Wow.
So reducing your fall risk is a biggie.
I agree with you 100% on that one. That's a huge one. Falling major is one of the major risks. And when you get into your 80s, your bones aren't quite as you're a little bit more brittle and things more easily break. That's for sure. Okay, Dr. Maissel, we have one more question to go.
Sure.
Great conversation. God, I love when I have you on. It's like excellent, excellent guest. What are some of the specific risks? And I got to admit, you're the one who brought this to my attention, so I'm kudos to you on the term. What are some of the significant risks related to solo aging? Maybe at first we should talk about what solo aging is, but then maybe talk about that.
Well, solo aging is when somebody does not have the traditional supports provided by family.
Hmm.
You could be married to someone, but be their caretaker. And so that spouse is not able to support you. You could be a solo ager. You could
Interesting.
you could have children, but either you're estranged from them or they don't live anywhere near you,
Right.
and you are functioning as a solo ager. And then of course, many people, more and more people don't have children. There's been a big demographic shift.
That's a conversation into itself, right? We see the birth rates in North America, around the world, have like gone off a cliff.
Yep. Or they may have children but not grandchildren. So there's the and we've had more mobile society and all kinds of reasons. So there are a lot more solo agers out there now.
All right. So I guess as a follow-up on that, do you believe there's the dynamics of this, the risk of solo aging is different for men and women? Do you think is it divided not just by age, but also by gender?
There is a little bit of a difference, and of course there's overlaps. But in general, the statistics tell us that men who are solo agers have a higher suicide risk and a higher risk of drug and alcohol overuse disorders. Whereas women's issues tend to be more around financial issues because women often were out of the workforce for a period of time, and fundamentally, women live longer.
Right.
Men tend to be more, you remember we talked earlier about the importance of connectivity in order to age well. Women traditionally are the social connectors in families. And so when a man is widowed, he may not have the skills to go out and to feel comfortable joining clubs or making those connections. And he may feel like, well, I've always done it myself. But unfortunately, that can be very isolating. And when he needs something, there isn't someone to call, or someone to check on him, or someone to take him home after his colonoscopy. So he just doesn't get it. And we know, if this is a tough statistic, but we know that the phrase is all-cause mortality. True solo agers have a 23% higher all-cause mortality rate.
So
I
in
think
other words,
you can,
they have a much higher risk of early demise.
yes,
And then on top of that, if it doesn't kill them, they become more miserable because of what you talked about, being alone, more likely to become addicted to their medications or start drinking way too much or whatever the case may be. Interesting. Okay,
But
go ahead.
but you can combat it. And that's sorry, I didn't mean to interrupt you, but you can combat it by moving to a community where you can make connections, by developing a relationship. And for some people, a reciprocal relationship is the easiest thing.
Sure.
I'll walk your dog if you give me a ride to my appointment. You don't
Right.
have to turn into a social butterfly, but you do need human beings.
100%. And, I guess what I would say for myself, because I'm very lucky to be connected with people all over, is what I'm hearing from you is that when I do eventually do retire many years down the road from now, that connecting that I have sort of taught myself is something that I would want to keep doing, even in once I am no longer have my practice up and running. It's something that's going to continue, just different.
Yes, it's
Interesting.
very important.
Hopefully, I'll be with many or some of the people I've already connected with. Will just be doing different things. Okay, before we wrap up here, this has been a great conversation. However, enjoyed having you, Dr.
Thank
Maissel.
you.
Thank you so much. Before we wrap up, what would you say, based on your experience, I guess more experience than opinion maybe, what's the biggest mistake people make when trying to plan for health in their later years? And once we understand what it is, what can they do to avoid, basically doing the same thing over and over again?
What I have seen is the biggest mistake is people underestimate the cost of really good care at the end of their lives.
Hmm.
Because sadly, at least in America, you will get care when you are acutely ill. But once you become sort of status quo, and perhaps that means you need someone to help you with certain tasks. Insurance doesn't pay for that. And many people assume Medicare will pay for those things forever, and it doesn't. And so there is a huge private pay market where people hire aides, and that can be very, very expensive. And that's the one thing that I see is that people either haven't planned for by setting aside enough money or just aren't willing to spend the money because they want to leave it to somebody, that not anticipating that the last stretch can be a very expensive stretch to be really comfortable is a big issue.
Okay, I'm glad you brought this up because I'm going to chime in on this one. I've seen it in very interesting, and I don't know if you have the same perspective, but I have, because there are some people in my industry that really don't want to talk about this aging, need for long-term care, need for care, planning for late. It's not always, happy conversation, or some people aren't comfortable having it. But to me, I think it's always something I really try to draw my clients' attention to. And here's one of the things I have noticed. And again, I'm not saying that I am my network of relationships is large enough to be any kind of, law of large numbers. But here's one thing I've noticed in my conversations with clients, and that is that women typically tend to, what's the word I want to use? Tend to, when I brought this to their attention, they tend to discount it, the need for this extra planning, this extra care, because I take really good care of myself. And, I'm not going to have all of these problems and, all these medical issues because I am fit, I exercise, I have all these activities, and et cetera, et cetera. Where I would say my male clients are more inclined to recognize their mortality and their vulnerability. Where I see a lot of my, I think these are highly educated, highly skilled, intelligent people. They'll tend to say, you know what, I'm going to be fine because I'm not going to age the way the mass public is going to. And what I think they're missing is the fact that, it's just like a professional athlete, everybody has a best before date, and in life we have a best before, it's realistic, everyone has a time where they have to, announce their retirement, right? and I think the term I would use is people become enfeebled. And once they become enfeebled, they become vulnerable, whether it's,
Yep.
a cognitive enfeeblement, if you want to call it that, like an Alzheimer's dementia situation, or if it's just a physical reality. And you brought it up, and I'm really so happy you did, about the financial implications of aging, not necessarily in the, what we call the fun years of financial independence. I consider that your 60s and 70s. That's really when people have usually that's when they really enjoy themselves. But the 80s and 90s can be a different story.
Mm-hmm.
That's my observation. And I just find that, I don't know if you've had the same, I'll ask you, have you found that philosophical difference between men and women, where men tend to acknowledge their sort of vulnerabilities more so than women will?
I can't say that I have, but those things are so hard to know. I think there's a wide variety of dynamics out there around that period before a person passes away, where some people are very frightened by it and other people are very calm and accepting of it. And I haven't necessarily noticed a gender difference, but I have noticed cultural differences.
Yeah, there's that one too, where, we're going to be fine because our family, our children are going to look after us. I've heard that one, which I am always skeptical of, but to each his own. You know what? We've had a great conversation today. I love having you on. We have to do it. I want to have you back again. I'm sure we're going to be able to come up with a great topic. We have seriously scratched the surface here. I'm hoping, again, we can have you back. But in the meantime, for the folks that were listening or watching today, they want to reach out to you and get a hold of you and have a conversation. What is the best way? How can they contact you?
Well, I'll give you my website and my email address. My website is www.mymdadvisor, and my email is gm for Gerda Maissel at mymdadvisor.com. And for those people that are interested, on Substack, I write a free monthly short essay on the American healthcare system, always with examples and tips that are based on my experience in the last month or two with my clients, that people are more than welcome to subscribe to, and they may find it interesting and useful.
Again, I want to thank you for taking time to join us today, Dr. Gerda Maissel. It was great to see you, great to talk to you. And I can't wait to have you back again on the 3 Questions podcast.
Thanks, Wayne. A pleasure.
I look forward to bringing you the 3 Questions podcast, and I hope you find them educational and informative. Please consider liking this video and subscribing to our podcast and YouTube channels. And to receive a notification of when our latest episode is being posted, please click on the notification bell. Lastly, to schedule an online consultation with me to discuss your wealth management needs, please click on the link in the description box below, www.onecapital.com/meet with Wayne. Thank you, and we will see you soon.